Hi everyone, in today's video I'm going to be going over the various treatment options when it comes to managing and treating schizophrenia. Welcome back to the Living Well with Schizophrenia channel. My name is Lauren and I make videos about what it's like to live with schizoaffective disorder or schizophrenia. And if you'd like to see more videos like this one, make sure to subscribe to our channel so as not to miss any future content. Also, if you would like to help support the creation of future content like this one, please make sure to check out the link to our Patreon page, which is in the description below. Any support is really appreciated. Thank you. All right, so schizophrenia is kind of an illness that requires kind of lifelong treatment, even after symptoms and whatnot have subsided. And it kind of requires treatment with medication, and different kinds of psychosocial interventions are going to help, stabilize an individual with schizophrenia over the course of their life and will help to manage symptoms over the long term. And so today we are going to be discussing more about what these medication options and different psychosocial interventions look like. A psychiatrist experienced in treating schizophrenia usually oversees the treatment of a patient with schizophrenia, but there may also be other team members involved in their treatment as well, such as a psychologist, a social worker, a psychiatric nurse, occupational therapist. Anything kind of like that may help to, improve the psychosocial component of the individual's treatment. And, these care teams are often available at clinics or whatnot that specialize in the treatment of schizophrenia. All right, so jumping into the different types of treatment options available for schizophrenia, the first one that I want to draw your attention to is what's referred to as early psychosis intervention. And so this is kind of, geared toward people who are having their first or maybe even second episode of psychosis. And they're, really early on in their journey, because there's a lot of evidence that the earlier you can intervene in a person's journey or experience with schizophrenia, the better prognosis and the better outcomes there are going to be long term. And so there are a lot of clinics that are geared towards this type of early intervention. So now, regardless of whether it's someone's first episode of psychosis or, later on multiple episodes of psychosis, sometimes it's kind of gets to a period of crisis where the symptoms are very overwhelming and the individual is not able to manage them on their own. And in these cases, hospitalization may be required as a form of treatment. Hospitalization may be required to ensure basic things like an individual's safety or medication compliance or proper nutrition or adequate sleep or, basic hygiene, and just restabilizing someone in those basic terms. Now, regardless of whether it's, early psychosis intervention or hospitalization, one of the things that is likely going to come of the two is the introduction or the rebalancing or whatnot of medication. So medication is thought to be kind of one of the cornerstones of the treatment of schizophrenia, and most commonly antipsychotics are prescribed for the treatment of schizophrenia. Antipsychotics are thought to control symptoms by affecting the brain neurotransmitter dopamine. Now, there are a multitude of reasons why someone may be a little bit adverse to taking medications, but severe side effects are very common with antipsychotic medications. And so this is one of the reasons why someone may be a little bit more reluctant to take them. And so for this reason, there are different options for getting it. So I had problem with adherence to oral medications. And so me and my doctor decided to switch to an injection format of medication so that I didn't have to constantly make that choice every day about whether or not I was going to take the medication. It was just kind of a once a month sort of thing that I went to the doctor's office, they gave me my injection, went home, and I was good for another month. So there's different options available for medications. So I will get into those a little bit. So in terms of oral medications, there are what's called first generation antipsychotics and second generation antipsychotics. And basically the first generation antipsychotics are a little bit older and they generally have more severe side effects because they're older. The newer antipsychotics are the second generation antipsychotics, and typically patients see fewer side effects with these. However, they are more expensive than the second generation antipsychotics, so that is something to consider in terms of long-term usage. And then, of course, there are the long-acting injectables, which I mentioned, which typically are administered anywhere from 2 to 4 weeks, and some even are every 3 weeks or so. And so these are becoming more popular as an option as well. those antipsychotics are the ones that are typically prescribed, but they can also be prescribed, patients with schizophrenia can also sometimes be prescribed things like antidepressants or mood stabilizers or anti-anxiety medications to kind of either address some of the side effects or to address some of the other components of their symptoms. Now, as I mentioned before, medication is really kind of the cornerstone to treatment of schizophrenia. And oftentimes it is kind of the first line of defense when someone is presenting with symptoms of schizophrenia. It's kind of what doctors go to in order to get the person to a more stable place where we can then introduce things like psychosocial interventions and other treatment options like that to complement the medication usage. And so they are very effective at helping to stabilize someone and get them to a place where they are able to work on more of the psychosocial interventions. They don't always get rid of the symptoms completely, which is why it is important to include other facets to your treatment as well. All right, so moving on to some more kind of medical intervention treatment approaches, there is what's called electroconvulsive therapy, or ECT. So the way this works is that the patient is put under general anesthesia, and electrodes are attached to either one side or two sides of their temple, and they are administered a small electric shock to induce a small seizure. ECT is ideally meant to lead to an improvement in mood and thinking. However, there's really not a lot known about the actual mechanism of how ECT works. It's just kind of something that doctors have seen some success in with patients, and so they kind of keep doing it. And, it is used more typically for people with depression because it affects the mood more pronouncedly. But it is still used sometimes for people with schizophrenia, but less than it used to be. A course of ECT treatments is usually administered 2 to 3 times or so per week for several weeks. So I myself got ECT when I was, first kind of going through, I was actually diagnosed with bipolar at the time. And so they administered me ECT to help me manage that because medications weren't really working for me at that time. And I got 12 treatments over the course of 4 weeks. It didn't really work for me. It didn't do much for me. And I kind of had some memory deficit problems as well following it. But, I have heard from a lot of other people that it has done wonders for them. And so I think it's something that you really need to make a personal decision about, and you really need to talk it through extensively with your doctor if it is something that you are wanting to consider trying. It is used for patients with schizophrenia when medications are no longer working, or if, severe depression or catatonia is affecting the ability to treat the illness. All right, so another kind of medical intervention in terms of treatment is transcranial magnetic stimulation, or TMS treatment. TMS involves a series of short magnetic pulses directed to the brain to stimulate nerve cells. Now, contrary to ECT, with TMS, the patient remains awake the entire time, and there's no need for general anesthesia or anything. They're just kind of sitting in a comfy chair, and the treatment can last anywhere from 5 minutes to 60 minutes, and generally, a treatment course is approximately 4 to 6 weeks. All right, so those are kind of the medical interventions in terms of the treatment of schizophrenia. And now I want to move on to the more psychosocial interventions that are available and encouraged for the treatment of schizophrenia. So, one of the kind of cornerstones of psychosocial intervention is individual therapy. And so there are a lot of ways this can look, but typically it's done with a psychologist or a social worker or a counselor of some sort who can provide some sort of individual therapy with a person. And another kind of effective type of treatment that they can offer through this is cognitive behavioral therapy, or CBT. This can help the person change their thinking and behavior, and a psychologist or a therapist of some sort will help the patient to identify ways to identify when their symptoms are flaring up and address or change their behavior and how they respond to it. And through medication and individual therapy and CBT and whatnot, an individual can be better equipped to identify when symptoms are flaring up and know how to reduce those symptoms or manage those symptoms. So this type of CBT has been particularly helpful for me in terms of dealing with voices and hallucinations, where I am experiencing a hallucination and I am now equipped with the tools to kind of question that a little bit more and really to be more critical of what's going on and to think more logically about, okay, is this really possible and how should I be reacting to the situation if not? Another thing that you can work on with an individual therapist is social skills training. There are a lot of different ways where schizophrenia can affect an individual's ability to interact and engage socially. And so, really working to work on these skills with the individual will help them to, better flourish in life and build more solid relationships that will offer more support to them when navigating their illness. Family therapy is another type of therapy that can be really effective and helpful for a person who is experiencing schizophrenia because, having the people around you, the people closest to you, your family, or whoever you identify your family as in terms of getting family therapy, can be really helpful in terms of providing education to the people who are, ideally supporting the person with schizophrenia, and also just, learning ways to communicate effectively together in terms of best creating an environment of support for the person with schizophrenia, and also teaching them how to communicate with their support network, what they need or what they're struggling with, and just creating a more healthy dynamic in terms of the people who are closest to you. Vocational rehabilitation and supported employment is also kind of a really important thing that often goes overlooked in the treatment of schizophrenia. The onset of schizophrenia is early adulthood. And, that is when people are building their careers and are getting a foothold in terms of, what they want to do with their lives and how they want to be employed. And, that's a big part of their lives in that period of time where symptoms are presenting, and the symptoms make it really hard to maintain employment. And so, working on strategies for this with the individual and working on obtaining some kind of supported employment to help them maintain that sense of purpose and, be self-sufficient in that way is really important. There are a lot of benefits that, being employed provides a person. It provides a sense of purpose in terms of contributing to society in some way. It provides a routine in terms of, knowing what the person needs to do in a day and what they need to accomplish in a day. It provides social connection and social engagement with their peers and coworkers and whatnot. And there are a lot of benefits to, helping someone work toward being employed. Another thing that really, really helped me in my own journey of recovery and my own treatment is peer support groups or self-help groups and that kind of thing. I can't overstate how important it is to be able to have dialogue with your peers who are going through similar things as you. That was kind of the turning point for me in one of my relapses, connecting with other people who could really empathize with what I was going through. And I could, share things without fear of judgment and without fear of being met with negative stigma or that kind of thing was really, really powerful. And so I think that peer support groups are hugely valuable in terms of treatment options for people who are living with schizophrenia or any mental illness or any difficulty really at all. If you can find a peer support group where you feel accepted and understood, that is huge. I think another component that's really powerful to the peer support model is just the elimination of the power dynamic that exists when you're getting treatment from a medical professional or a medical team. When there is that power dynamic involved where you feel like your psychiatrist or whoever has control over your treatment and your course of care, that can seriously affect, what you share and how you approach your treatment and your recovery journey and whatnot. And so, eliminating that power dynamic and being surrounded by your peers is, again, really powerful in terms of, opening you up to sharing more and really getting at the root of what's going on. And I really think that, peer support can help encourage self-acceptance around the illness and, better insight into your own experience of your illness. Another kind of psychosocial intervention that's a little bit more formalized is the Assertive Community Treatment teams, or ACT teams. They help people with schizophrenia, or people with various mental illnesses, but people with schizophrenia to stay within the community instead of needing to access emergency services like the hospital and whatnot. And they work on these various life skills that we've been talking about, and they work on medication compliance and all that kind of stuff with the individual in their own home or in whatever environment they feel most comfortable in. Now, I have never had any experience with ACT teams, but I think that they would have been hugely helpful for me at various periods throughout my illness when, things were either getting a little bit harder or when I was coming out of the hospital as just kind of more of that wraparound treatment. Now, something else that's a little bit more formalized in nature that is garnering more and more attention lately, especially in places like the UK, is what's called social prescribing. And now this is something that I got really excited about during my schooling as a new concept in terms of providing more psychosocial interventions to people who are living with severe mental illnesses. And basically what this entails is a doctor or a healthcare professional moving beyond just prescribing medications and being able to prescribe various social intervention components to care as well. So that could be like prescribing art classes or prescribing a gym membership or some kind of physical activity courses, different things that may help a person feel more engaged within their community and more, full as a human being. And so working on the psychosocial component as a means of prescribing to people who maybe don't have those things within their reach financially or otherwise, instead of just prescribing medication. Now, there's a lot of criticism around this concept where people are kind of leery about the government or public health infrastructure paying for people's art classes or gym memberships or that kind of thing, and seeing that more as something that is more on the individual to provide for themselves instead of the government. And, I get this criticism. However, it's really important to understand that when we are supporting a person in this way, it actually ends up costing the system less because this individual is more stable overall and is using less emergency services like the hospital, is potentially more able to be self-sufficient financially in terms of having employment and thus not needing as much government support financially, and just various factors like that just, reduce the amount of expenditures that the government is actually spending on them. A study in the UK found that for every pound that was spent on these social prescribing programs, 2 pounds was returned in terms of social gains. And so, there is evidence that these are both fiscally responsible and also are just, better in terms of a more holistic approach to the treatment of mental illnesses like schizophrenia. All right, so there are more kind of psychosocial interventions that an individual can work on their own. And this can include things like maintaining proper nutrition, getting enough physical activity or exercise, getting enough sleep. These are kind of the cornerstones of maintaining wellness in terms of, the psychosocial components of treatment for schizophrenia. These are really important. I know for me, sleep is probably the most important factor in terms of my treatment. Making sure that I am maintaining a regular enough sleep schedule and also getting enough sleep each day is really important in terms of managing my symptoms. And then, of course, things like nutrition just help with overall health and overall mental clarity and whatnot. And exercise is something that is also really important for me in terms of maintaining mental clarity and just taking care of my mind and body. Getting outside for exercise, I really love to run and I love to run trails. And so this is just a really grounding, balancing activity for me that I really enjoy and find great value in. I mentioned briefly routine in terms of employment, but there are a lot of other ways that you can create routine within your own life, whether it's, meal times or what you do with your day or how you structure your day, or even just as basic as when you go to sleep or that kind of thing. Just building in some sort of routine, I find for me really helps in terms of my treatment and management of my symptoms. Another important and sometimes overlooked component of treatment is surrounding yourself with a great support network through friends or family or whoever that may be for you. This is really important in terms of feeling integrated within a community, feeling loved and cared for. I think this is important for anyone, regardless of if you have a mental illness or not, to feel, that form of connection with other people in your life. Friends and family can also kind of help to intervene or notice when things are starting to slip or go awry or symptoms are becoming more pronounced. I think also, the more people you can include in this network of support and the more people you can be open about your illness with, I think, the farther society is going to go in terms of reduction of stigma around mental illnesses like schizophrenia. I think that this can only serve to help with the increase of self-acceptance around having a mental illness like schizophrenia. I think that is a huge hurdle to jump. And, that maybe that's saying it wrong, because I don't think that it's just merely a hurdle to jump. I think it's a lifelong process. Self-acceptance is definitely something to pay attention to and work toward in terms of your treatment when it comes to managing your schizophrenia. So something that has helped me along this journey of self-acceptance is working on educating myself and working on illness insight. And so this can take the form of, more immediately looking for information about schizophrenia or about the mental illness that you may have, and, better educating yourself on what it means to have this illness and engaging in that information with your own experiences about what it has been like to navigate this illness. But beyond educating yourself specifically on the illness, I think that broader education has really helped me in, being able to think more critically about my symptoms, about what it means to have schizophrenia, about my role in the world and how that interplays with having schizophrenia. And I think it has just better equipped me to be able to develop coping skills and to develop resilience when it comes to navigating having a mental illness like schizophrenia. All right, so that wraps up what I wanted to touch on in terms of the treatment options available for schizophrenia. I just want to draw your attention again to the importance of early psychosis intervention and how, if at all possible, this is really pivotal in terms of the treatment of schizophrenia. However, medication is also kind of seen as the cornerstone of treatment of schizophrenia. And so it's a really important component most of the time. However, there are definitely other components that need to be present to complement the medication and to increase their ability to adequately treat the person's symptoms and to manage the person's schizophrenia. All right, so thank you so much for watching this video. I hope it was helpful in some way. If it was, please give us a thumbs up and also make sure to subscribe so as not to miss any future videos. Also, again, if you would like to help support the creation of future videos like this one, please make sure to check out the link to our Patreon page, which is in the description below. Thank you so much for watching, and as always, wishing you and your loved ones good health. See you in the next video. Bye.